Hi guys, this is Mark, and this is the next installment in Mark's prostate cancer experience. It's been a little while since I posted a video, and I'm shooting this today for a couple of reasons. First of all, it's a beautiful day here in Miami Beach, and as you can see, there's a lot to be happy about. So a couple things. I'm going to talk today about preparation for your surgery, including Kegel exercises, and also exercises for your core, your midsection. The more that I talk to men from around the country and around the world about their outcome, I'm tending to find that people who've had less than desirable outcomes didn't have the proper preparation for surgery. So I'm going to talk about that. But first and foremost, I do want to announce that today, as of shooting this video, I'm shooting this on April 1st, 2017. It's roughly 17 months after my surgery, and I got my next PSA test results back, and they continue to be 0. So this is very encouraging, of course, and to all of you who are both pre and post surgery, a 0 score is something that you should very well expect if you have a proper surgical procedure. I can only relate to the surgical solution to prostate cancer. Those of you that have looked at radiation and other therapies, you'll know that I'm not a big fan of those. I believe in surgery, but that's my opinion. I think radiation is fine if after surgery you find yourself in trouble with a little bit of PSA rise after that, but surgery is the way to go, so that's my 2 cents. Anyway, regarding preparation for surgery, I would always suggest that between the time that you're diagnosed and the time you have surgery, you start to prepare yourself. Typically, if you have a biopsy and the biopsy shows that you have prostate cancer, you're going to want to let the prostate heal probably for about 6 weeks to 2 months. But don't worry, because prostate cancer, assuming you have a Gleason score of 6 or 7, generally speaking, is a very, very slow-moving cancer. So you could literally not do anything for 6 months, 12 months, and you wouldn't be any worse off. But you never quite know. But the point being, after your biopsy, you want to wait about 2 months before your surgery. But when your surgery is scheduled, I'd like to recommend starting at 30 days before surgery. There are 3 things that you do. First and foremost, start to change your diet to eat much healthier food. Stay away from processed food, stay away from red meats. Just focus on, if you want to go vegetarian, that's fine. But just focus on eating healthy, eat natural foods. A paleo diet, P-A-L-E-O, is one that's certainly very well regarded. A paleo diet is called the caveman diet, and it basically consists of foods that are naturally occurring in nature. So vegetables, beans, rices, chicken, fish, beef, all that's fine. Keep the red meat to a minimum though, but just eat that way for 30 days leading to surgery, and your body will just kind of cleanse itself quite well. So number 1 is diet. Number 2, Kegel exercises, and everybody talks about these, and I think in many cases they're misunderstood. A Kegel exercise is just a very brief and light clenching of your buttocks. The scenario that a lot of people describe, it's as if you're going to pass, it's as if when you have to pass gas, you just hold it in for a second. It's not a tight squeeze, it's not a hard squeeze. As a matter of fact, I'm doing them right now as we speak. 1, 2, 3, release. 1, 2, 3, release. And you'd never really know. So it's just a very brief kind of clenching. Now, 30 days before, what you want to do is probably every other hour or every hour, depending what you want to do. So about every hour on the hour, you just do about 10 of them. So you're going to clench like 1, 2, 3, let go. 1, 2, 3, let go. I'm doing them right now. 1, 2, 3, let go. So I'm not straining, Some people overdo them, and it's just as bad as not doing them. So just very simple, squeeze, 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 let go. Over time, you're going to find that you can hold it a little bit longer. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and I've just let go. You couldn't tell. You can do these standing, walking, sitting, but do them over and over and over again every waking hour. If you do this, what's going to happen is your body is going to start preparing itself for the point where the prostate is no longer there. Then all of a sudden you have perfect urinary control. Now, I'm not a doctor, so everything I'm talking about is just my own experience, but do consult with your doctor on anything that I advise you on. But I tend to find people that do their Kegels 30 days before tend to have zero continence issues from day one. And that was my case. The day that my catheter came out, I had full continence. The first day, you have a little bit of leakage, but the most important thing is that you're able to stop a stream or hold it in. If you browse the internet, you're going to see a lot of stories about people who can't hold it in or on the way to the bathroom, it all goes. Every individual is different. Each of our experiences is a little unique, but your Kegels are going to be a very, very important component of that. So don't let that go by. The third thing is exercise. Your body is going to undergo some stress. Surgery on the body of any kind, no matter how minimal, is always going to be a shock to the system and a shock to the body. So you want your body to be in relatively good shape. Starting at about 30 days prior to surgery, and even longer if you can, I would suggest you go to the gym at least 3 days a week. And if you have the means to work with a trainer, please do so. But if you don't, it's really quite simple. What you want to focus on is what's called core exercises. And your core is basically your abs, your lateral obliques, which are sort of the abs on the side, and you just want to focus on getting them firmer and tighter. And there's a number of ways to do it. You can go onto the internet and just Google, 10 simple core exercises, but sit-ups are fine. I would demonstrate if I had my gym clothes on, but you can grab a medicine ball at the gym, stand straight, and just take the ball from side to side, like this right here. Pretty easy stuff to do. You can lie down on the ground and you can do sit-ups, but don't just do sit-ups, do different ones. You want to get the lateral obliques, you want to have some twisting motion, you also want to have some core motion as well. You can lie back on a mat like this and lift your legs up and down, which I'm not doing right now because I'm in a sitting position, but there's all different ways to do it. If you tighten up your midsection area, that's the area that the surgeon will go into, and the more firm it is, the better in shape it is, the easier it is to do the surgery. So don't over sweat this whole thing about working the core. Do as much as you can. Typically, those of us having the surgery are in our 50s, 60s, and 70s, so we don't quite have those bodies that we used to have. So we're not looking for washboard abs, we're just looking to kind of get a little bit of a tightness there. But one thing I do want to mention is, after surgery, and as I mentioned, I'm quite a few months, I'm well over a year, almost 17 months. If you look at my early videos, I was a little bit heavier then, so I've kind of focused post-surgery on eating a little healthier. I've kind of kept my body in shape, trying to work the muscles a little bit, not too much, but I'm 53 years old, so trying to basically do as much as I can. It's all about a lifestyle and a health shift, and so my life has not changed dramatically. I'm still at the gym, I'm still cycling, I'm still swimming, I'm doing all sorts of active activities. I love hiking in the mountains. We don't have a lot of mountains here in Florida, so it means I got to travel to get to mountains, and I have no issue with doing that whatsoever. So basically, that's the preparation. Eat as well as you can. Do your Kegel exercises. Don't forget the Kegels. That's the most important thing you can do. And try to get to the gym and work out your core muscles. Go to Google, type out core muscles, core muscle workout. And also, if you haven't discovered my Facebook group, I've created a Facebook group called Mark's Prostate Cancer Experience. And it's an amazing group. A lot of guys are in there now sharing their experiences. It's a great peer support group before and after surgery. So check that out, and we'll see you soon in a future video.